Hi, everyone. This is Ken with Ken's Insurance Agency. We're coming to you today because open enrollment is here for both ACA and Medicare. We want to give you some information on both ACA and Medicare and why they're important and the different plans we can help you with. So let's get started. Let's start with Medicare. So Medicare, it consists of several parts. There's Part A and Part B, which is handled by Social Security and the government. Part A, we'll cover all these in more detail as we go along. Part C is Medicare Advantage. Then you got a supplement. Then you got Part D. Medicare is health care for the disabled and for seniors. Open enrollment is October 15th through December 7th. There's also the 7-month period around your 65th birthday, which starts 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. You also can enroll through SEPs when you qualify, like receiving Medicaid. If you have a chronic condition, sometimes there's SEPs within that. If you move in or out of a nursing home or a long-term care facility, there's SEPs for that. Also, if you move in or out of the coverage area, there's SEPs for that. You can face penalties if you do not sign up for Part A, B, and D around your 65th birthday or let your coverage lapse, except for if you already have credible insurance according to what Medicare determines as credible insurance. Every year, open enrollment, your plan must be reviewed and updated accordingly. Medicare Part A covers inpatient hospital care, skilled nursing facility care, long-term care hospitals. Most people don't pay for Part A. If you do pay for Part A, you'll pay up to $422 each month. The way it's based on whether you have to pay or not is on the quarters that you work. So if you work less than 30 quarters, you'll pay $422. If you worked 30 to 39 quarters, you'll pay $232. Also, you'll have a deductible that rotates every 90 days. The only thing is, if you're in the hospital, you pay your deductible, then you pay your little co-pays that you'll have, and then you have to be released before your deductible starts again and the cycle starts again. Days 1 through 60 is zero co-insurance for each benefit period. Day 61 through 90 is $335 co-insurance per day of each benefit period. Days 91 and beyond, if you have lifetime reserve days, that's where this comes in. You'll have a $670 co-insurance for every lifetime reserve day that you got. Once your lifetime reserve days are over with, you're responsible for all costs beyond the lifetime reserve days and beyond 90 days. Your deductible is $1,340 for Part A every time you have to pay it. Medicare Part B. Part B covers 2 types of services. Medically necessary services are services and supplies that are needed to diagnose or treat your medical condition that meet accepted standards of medical practice. Preventative services, healthcare to prevent illness like the flu, are detected at an early stage when treatment is most likely to work best. You pay nothing for most preventative services if you get services from a healthcare provider who accepts assignment. Part B covers things like clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, getting a second opinion before surgery, limited outpatient prescription drugs. The standard Part B premium is $134. It can be higher depending on your income. Also, some people pay less if they receive Social Security SSI benefits. Also, you will have $183 per year deductible. After the deductible is met, it's a 20% co-insurance. So Medicare Part C, which is also known as Medicare Advantage, in some areas it's also known as Medicare Select, is a plan that will cover your medical and doctor provided by private insurance companies. You must have Part A and B. It usually includes Part D. If you get Part D, you have to get the Part D that comes with the plan. You cannot buy it separate. Has a very affordable price, anywhere from $0 to $100. Has deductibles, co-pays, and co-insurances. Usually comes with extras like a free gym membership, hearing, vision, and dental. Medicare Supplements is a way to pay your out-of-pocket expenses. Must have Medicare Part A and B, cannot have Part C. Part D is sold separately, is more expensive monthly than Part C, broken into different versions, A, B, G high deductible, M, and N. At the end of this year will be the ones available. Right now, if you do qualify for Medicare, you can get C, F, FI deductible. Medicare Part D is prescription drug coverage provided by private insurance companies. Must have Part A and B. Cannot be part of a Medicare Advantage. Can be part of a Medicare Advantage Part C or sold with a supplement. If you have Medicare Advantage, you must buy the Part D that is included in the plan. Each Part D plan has its own formulary, which determines what drugs are covered. Each formulary is broken into tiers, which determines the cost of the drugs. You can ask for an exception if your drugs are in a higher tier or if your drugs are not covered, but it's done through your doctor and your pharmacist. There are things like STEP programs and stuff like that that they'll want to do to see if you can take another drug that's on the plan and all before they grant the exception. If they are going to remove one of your drugs off the plan, they must provide written notice 60 days prior to the date the change becomes effective, or when you go to refill your prescription, provide a written notice and a 60-day supply of the drug under the same plan rules as it was before the change. What you'll pay with a Medicare drug plan, you'll pay your premium, you'll pay your yearly deductibles, co-payments and co-insurances, cost in the coverage gap. If you get extra costs, extra help, there'll be costs, which basically lowers your costs, like in the coverage gap and your co-payments and co-insurances. Cost if you pay a late enrollment penalty. How the costs are calculated, the drugs you use, the plan you use, the pharmacy, whether it's in the plan's network or not, the drugs, whether they're in the formulary or not, whether you get extra help paying for Medicare Part D costs. So all these go into it. Okay. So if you have to pay a late enrollment penalty or you earn too much, there are penalties that go into that basically can raise your premium. And those are stated by Medicare. You can have your Medicare Advantage and your Part D coverage deducted from your railroad check or your or your Social Security check. The maximum drug deductible in 2019 is $415. When you enter the coverage gap in 2019, it's $3,820 that you've spent. You'll come out of the coverage gap when you spent $5,100 in 2019. At that point, you pay very little on your drugs. During the coverage gap, you'll pay 35%, usually. You can also get supplements to help offset some of your medical costs, like a cancer, critical illness, hospital indemnity, or a Medicare gap plan. One thing also to remember, if you get a supplement or a Medicare Advantage, you cannot get the other. You would have to unenroll from one to get the other. So just remember that. We're going to stop sharing and go to talking about the healthcare. So right now, since November 1st, going through December 15th, we've got ACA open enrollment going on where you can get your health plan that has no pre-existing condition clause in it. These are also known as exchange plans, Obamacare. So we can help you with that. We do have to dig into your finances and your personal life a lot more. So be prepared for that with this. But we will be glad to help you. You can end up getting basically a very affordable plan with going this route, or your plan could be very expensive. They will want to verify income and different things. So that is one thing to think about. The next thing to think about is maybe an off the exchange plan, which would be like an ACA alternative, which will have like a 12-month pre-existing condition clause to a 24-month pre-existing condition clause. We generally sell the 12-month. The next one to think about is short-term, which will cover you up to 364 days. Great for filling gaps where you're expected to get coverage at a period of time and all, but need to basically fill a little gap from the time you lost coverage to the time you're getting coverage. Does not cover pre-existing conditions at all. The only time pre-existing conditions would be covered is if they happen once the plan is in effect. So like if you get the plan and then have a heart attack, that heart attack is covered up until the renewal time. So just keep that in mind. But if you had a heart attack before you got the plan, then any treatment for that heart attack would not be covered. Then there's short duration medical health plans Those are great. Also, they usually have a 12-month pre-existing condition clause. Can cover anywhere from 12 months to 36 months. So a great plan to have. Then you got your ancillary benefits like teledoc, telecounseling, which we'll take a look at. You also have accident plans, which pays if you're injured in an accident and go to a doctor or hospital. Hospital indemnity plans, which pay if you go to a hospital for a sickness or injury. Critical illness / cancer, which pays if you get diagnosed with and are being treated for cancer or heart attack or stroke. Some will include other benefits where you can access money off of them. Then the next type is your dental, your vision, your hearing, which you can get. So these are important. All of these things can be included into a benefits package also for a company. So please feel free to check us out if you got a company and want to get information on your benefits package. Now let's take a look at our teledoc service and what's included in it.
Our Real Money team is back, saving you a lot of money on your doctor bill. Americans, on average, spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service.
Hi.
But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money to take off from work, to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctor's office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
Well, it'd be $100 just to tell me that I got the poison ivy that I know I have.
Taking a picture.
I have the picture.
Uploading it and answering a few questions. An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits. In all, Phil's bill was about half of what it usually costs him to visit the doctor's office. And Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money!
Sometimes it takes a little while for a new idea to catch on, but when it does, watch out. Just look at Teladoc, TDOC, the world's largest virtual healthcare provider. We've been following this story for over a decade, ever since Teladoc was still a tiny startup. I've always thought it had an amazing concept. Let people have video conferences with their doctors. You shouldn't always have to go to the doctor's office to get medical care. Hey, sometimes you get sick when you go to that office too, let's face it. Not long ago, Teladoc came public, 2015. The stock quickly went into free fall, plunging from the 30s to the single digits in a matter of months. Since then, though, it's been a rocket ship, a deserved one. Last year, Teladoc more than doubled. It's up more than 60% just from 2018. Now we're in a situation where the results are speaking for themselves. Plus, just last week, the company announced that it's buying a competitor, Advanced Medical, and its stock shot to new highs. Let's check in with Jason Gorovic. He's the CEO of Teladoc, to learn more about this deal and his company's prospects. Mr. Gorovic, welcome back to Mad Money. Good to see you, sir. How are you?
Good to see you.
All right, I got to tell you something. You should be very pleased by what I'm about to tell you. I posted in this on my Twitter file. Teladoc. I have, most people are very critical on Twitter. There was not a single negative experience. It was just positive experience after positive experience after positive. What are you doing?
It's funny you say that. I used to run health plans. I got a lot of hate mail when I ran health plans.
Well, I figured I'd get a lot of hate mail when I put your name up.
Now I get fan mail. Maybe not as much as
tell me about that. I love this contrast.
No, it's great. It's we're delivering care to people where they need it, when they need it, on their terms, right? And that's how the healthcare system should work. And it's nice. Consumers are understanding it. Payers are understanding it. Employers are understanding it. And we've been fortunate to be the beneficiary of that.
One of the tweets was someone got sick in the car, pulled over, called, got a diagnosis. Can it be that simple?
Oh, it really can. Yeah. I mean, technology being what it is, we can now match a doctor with a patient in their jurisdiction where they're licensed, matched up with their specialty, and take care of them in a matter of minutes. And, look, people get sick not on regular schedules.
Right. Now, it is 24/7. Also, this new acquisition, to me, makes you the worldwide leader.
That's exactly right.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic, but do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctors listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of Teladoc doctors, 15 years. Average time it takes to get a call back from a Teladoc doctor for the quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
What is that?
A bottle.
A bottle. What's in the bottle?
Nothing.
Nothing's in the bottle. All right.
See?
Exclusive.
Mom, come on.
I'm still working. I just need more help from you.
I'm doing the best I can.
I feel like everyone is leaning on me to do everything, Mom.
It wasn't always easy with you and your dad either. But you're losing out on moments you aren't going to get back. Maybe it's time you talk with someone.
Hi. Thanks for seeing me.
I'm glad you scheduled some time. How can I help? make some mental notes, and we can talk about it next time.
Thanks, Dr. Brown. Let's meet next week. This castle needs a dragon. Huh?
I'm finally asleep. How are you?
I'm good. I think we're going to be all right.
I wanted to stop it real quick right here and let you know that the teledoc and telecounseling service, we have no copays with it. Whereas when teledoc's included with a health plan, there's generally copays included with it. And also the telecounseling is usually not included with a health plan when it's included. Also, what you just saw on how easy it was to set up an appointment, it's really that easy. And the pregnancy question, there is no waiting period for pregnancy as far as it and all. In fact, we're not even going to be able to test you for pregnancy with this service. But the fact is, if you are pregnant, there's changes that happens in the body, as you already know, and stuff. And that can affect what is wrong with you, to where they need to know, one, from a treatment standpoint, which medicine is safe to prescribe, and two, is it the pregnancy causing this condition, or is it possibly something else? So that's the reason for the pregnancy question, and that's the only reason for it.
Do you not have insurance for prescriptions? Not enough coverage or no coverage at all? Are you not getting the medicine you need for care because of the cost? Despite for almost a decade, chain pharmacies nationwide have been selling select generic drugs for as little as $1 per week. Medicine cost is still a burden to households across the United States. Our program will lend you a hand. Now that you have access to the doctor with our teledoctor service, let's get the prescription worked out. If your insurance plan does not cover the cost of all your medications, or if you do not have insurance and you choose the cost-effective generic drug route, either way, our plan will drive down the out-of-pocket expense. Get discounts at over 58,000 national chains, regional chains, and independent pharmacies. Get 20% to 60% off retail prices for generic drugs and 20 to 40% of name brand drugs with no limits on quantities. Use mail order pharmacy as well and purchase up to a 90-day supply of your maintenance prescriptions. Our membership card is the gold standard for prescription savings. Enroll today. I know what the next question is about: vision. Don't worry, we have the answer. Your healthcare savings plan also includes 15% to 35% off normal retail prices for frames, lenses, and specialty items, such as resistant coatings and ultraviolet protection. Contact lenses and even LASIK and PRK procedures also receive discounts, up to 15% off retail prices, as a matter of fact. This keeps money in your pocket should you need glasses, contacts, or ophthalmology services at any time. Just present your membership card and save all around. Enroll today.
If you don't have a roadside assistance plan for your car, you may want to get one soon. One of the most common things we never think about until it happens: transportation issues. The winter and fall months are when most drivers need help with such issues as dead batteries, flat tires, and keys locked inside their car. Spring and summer are filled with road trips and more time behind the wheel. You could miss work, family activities, important dates. Never be stranded again. In our package, you have access to emergency road service 24 hours a day, anywhere in the US and Canada. We deliver gasoline, change tires, provide jump starts, unlock the vehicle, winching and extraction services, and delivery and installation of parts. We'll also tow your covered vehicle to a location of your choice. We do it all to keep you on the road.
It seems like AIA covers everything and truly simplifies your life. But something is missing. What about man's best friend? Well, we have that covered too. Pets are unpredictable. While it's hard to anticipate accidents and illnesses, our affiliations with Nationwide helps make it a little easier to be prepared for them. From preventative care visits to significant medical incidents, Nationwide provides protection for pets when they need it most. Nationwide policies cover a multitude of medical problems and conditions related to accidents and illnesses, including cancer. Coverage is available for dogs, cats, birds, and exotic pets. Plus, optional wellness care coverage reimburses for vaccinations, flea tick preventative, and more. Members are free to use any veterinarian worldwide, even specialists and emergency care providers. Best of all, members are eligible for preferred pricing, which makes this peace of mind protection even more affordable. You're free to use any vet, anywhere, receive preferred pricing as an AIA member. Also, our 24/7 vet helpline is available as a service to all pet insurance members, a $150 value. Tell a doctor for pets. That's right. All pets deserve to live life to the fullest. That's why we're there for the big stuff, the small stuff, and all the stuff in between. Enroll today. The AIA membership is the gift that just keeps giving. You earn AIA rewards just for being a member. Use your rewards to save on travel, gift cards, merchandise, and more. The savings are available to the primary member plus their dependents. Save up to 40% on 13,000 hotels and condos worldwide. Enjoy 10% discounts on popular dining and retail gift cards. Get up to 80% savings on the daily deal. Save an average of 46% on software. Find deals on jewelry, apparel, electronics, cruises, and more. As a new AIA member, you receive $250 AIA rewards online account. Plus, an additional $50 in rewards will be deposited each month you remain an active member. To start using your AIA rewards, simply log in and start saving. Enroll today. Association RX. What if you knew the cost of your medicine before you went to pick them up? And what if those drugs were tiered and capped for your benefit? Look no further. Select our pharmacy add-on to your Simplify package. Our relationship with Association RX has a network that includes over 60,000 pharmacies throughout the U.S. The network includes national chains as well as thousands of independent pharmacies.
up to 65% savings on generic medications, with overall average savings of 40% across brand and generic medications combined. This program is designed to help you find drugs within the same therapeutic class as a drug you may be currently taking. Most of all, this program is designed to save you money on your prescription drug costs. This program offers 4 tiers of saving. Tier 1. The first tier is generic drugs that will be available to you for a payment of up to $10. Tier 2. The second tier is brand name drugs and select drugs that will be available to you for a payment of up to $20. Tier 3. The third tier is brand name drugs and select drugs that will be available to you for a payment of up to $50. Tier 4. The fourth tier is brand name drugs that we have negotiated special network pricing for you. For special network pricing, present your card at a participating pharmacy. You can visit www.associationrxcard.com for more details. Log on and check the price of the drug you are looking for and see participating pharmacies. To get the most out of this program, you should ask your doctor to prescribe a drug within the first 3 tiers if possible. Secure your pharmacy needs with AIA. Enroll today. Dental. Everyone wants that perfect smile and that amazing treatment plan. Add on dental to our Simplify plan today. Now, our members can save 5% to 60% on virtually all dental procedures. Since the dental program is administered by Carrington International Corporation, you now have access to one of the largest dental networks nationwide. Members will pay the discounted rate at the time of service. Receive unlimited access to care with no limits on the number of visits. The procedures range from cleanings and fillings to root canals and crowns. Savings on orthodontics are available for both children and adults. All dentists must meet highly selective credentialing standards. Visit any participating dentist on the plan and change providers at any time. You can smile again. Secure your dental options with AIA. Enroll today.
So for everything that you saw through the AIA rewards, including AIA rewards, is our baseline prep package. And for all that, you're looking at $49 a month plus a $1 enrollment fee. That's one time. The tiered pharmacy and the dental each have a little extra fee that you'd have to pay if you wanted to add them on. So that shows you those. Please contact us if you want to get health insurance. Our coverage area is Mississippi, Tennessee, Arkansas, Louisiana, Alabama, and Michigan. Does not matter if it's Medicare or if it's an ACA plan that you're wanting or if it's one of the others, or even if it's the ancillary products like dental, vision, accident, cancer, critical illness, and so forth, even disability, or even if you're wanting to get a benefits package set up or review your benefits package and see how we can help make it better and maybe even save you some money on your benefits package. Give us a call. We give free quotes, free policy reviews, and free education on all of our policies. Look forward to helping you. Give us a call, 662-912-3914. Again, that number is 662-912-3914. Thank you and have a good night.